We have done all types of role plays, provided they can be done generally and they are legitimate steps on a person's hierarchy. For example, one woman felt uncomfortable driving on crowded city streets, but what was worse was that she feared she would get into an accident, and the other driver would jump out of his car, run over to her in a rage, and scream at her in public. This is a situation in which a role play works well. After the accident, she gets out of her car, and as expected, the man is very mad. He starts yelling at her and accusing her of all sorts of malfeasance. It is her job to remain calm, move into her peace zone, and to talk slowly and precisely. This kind of behavior has the added effect of calming the other person down and deflating a pressurized situation. We have used role plays for many other anxiety-causing situations. The key to a successful role play is that the other person, usually the person being unreasonable, only goes as far in being obnoxious as you can handle. We need to move the drama of the role play up hierarchically as the weeks go by. Someone really shouting loudly at you and calling you names is too much for the first time you try a role play. But as you become more confident and in control, the more you will be able to handle someone who is shouting at you or mad at you. Just as with the cognitive exercises, we want to start the role plays and other behavioral activities slowly and gradually and move ourselves up. So please keep this in mind from the very first day that you participate in the behavioral therapy group. Another group behavioral exercise is the paradoxical strategies that are on some people's hierarchies. For those people who have social anxiety and a strongly associated physical symptom that accompanies it, like hands that shake in public and blushing, then the paradoxical strategies can be very helpful. The main idea of a paradox is to do the opposite of what you would expect. Therefore, the person who has anxiety over writing a check at the grocery store or filling out a form in a public place in front of other people deliberately over-exaggerates the problem in the behavioral therapy group by making his hand shake as much as possible as he signs his signature on a table or on a chalkboard. It is the paradox that is important. Over-exaggerate that shaking, deliberately allowing yourself to look foolish, and you'll find the pressure has knocked down a peg or two. It is the same with people who tend to blush excessively. It is good when they volunteer to stand up and blush in front of the group. When a person deliberately tries to blush, it is almost impossible to do so. And the more the group encourages them to blush, the more absurd it will seem to them. Or as one of our group members put it, as she did her first blushing paradox, "Are you all ready to see Tomato Head in action?" Gradually, slowly, and as these paradoxical exercises become easier in the group, they need to be practiced in the outside world. But let me repeat again, this should proceed slowly and gradually. Another strategy we always use for some of these symptoms consists of practicing the feared event, such as hands that shake, by having the person fill out an application or form in front of the group. But we do this in a hierarchical manner. That is, maybe signing a check first in front of a small number of people, then writing something that takes more time, then writing in front of a larger audience, then writing something with total and complete silence in the room, while everyone gazes intently at the person's writing. Cognitively, the person should be told, Now take it easy. This is no big deal. So what if there are other people around? I can do my slow writing. I'll just take my time and do the best I can. That will have to be good enough. A rational, cognitive statement like that, while the person is under stress, is very therapeutic. If the person slows their writing down, they will be much more in control and will be able to write with much less shaking. Some people find this next group activity to be very difficult, while others consider it a minor achievement. But breaking down the wall of inhibition and self-consciousness we live with daily is a major step in overcoming social anxiety. Therefore, one of our group exercises is called deliberately doing something foolish in public. These are activities we would not particularly want to do, and we really wouldn't want to do them outside of the group. But by doing them in front of other people with social anxiety, the bonds of inhibition can start to break. An easy way to get into this is through using what we call our animal noises. I usually start this activity, and of course no one is forced to join in, but everyone is encouraged to make some kind of animal noise, or just any noise for that matter. I usually bark like a dog or snort like a pig, encouraging the group members to join me with their own sounds. This can be a breakthrough for some people, who find the very thought of this impossible at first. As the group progresses, I will make faces at the group and encourage them to make faces back at me. I will do anything and everything to loosen them up and get them to imitate some of my uninhibited behavior. I will get on the ground, bark like a dog, and scurry over to someone barking at their feet. They usually laugh and either bark back or sometimes join me on the floor. Then we go around to other people to see how many animals we can make. Doing something deliberately foolish in public includes activities like karaoke in front of the other group members, performing in a silly skit, reciting nursery rhymes as Mother Goose, telling an embarrassing story, or singing a song to the group, especially when you're not a good singer. The idea is to break down the inhibitions that we have all lived with for so long. There are many other activities we use that will be spelled out in the specific series that deals only with the behavioral group therapy. Although we mainly use the next exercise for people whose voices are too soft, people that are almost always afraid to hear their own voice, it is also a useful exercise for breaking down inhibitions. In this behavioral exercise, one quiet person goes 2 or 3 rooms down the hall where they can't be seen, and they carry on a two-way conversation with another person who is sitting in the group room. We call this the house shout, although the people do not actually shout, but they raise or project their voices more in order to be heard. It is harder to be the person sitting with the group and carrying on a conversation with another person several rooms away, but these roles can be traded off. All the 2 people do is carry on a conversation about anything, but loudly enough so that everyone can hear everyone else. An offshoot of this is the yard yell, when we all go outside and yell at each other over the building. This does involve shouting or yelling, and we never want to disturb other people. But at the right time and the right place, this can be another effective strategy. Yet another offshoot of this which also encourages making conversations, is to have everyone in the group carrying on a conversation with one other person at the same time. And the two people carrying on the conversation are sitting across the room from each other. So if you have 6 people in the group, you will have 3 conversations going on at the same time, and each person will be raising their voice so their partner can hear them, since they are sitting at the opposite side of the room. This has been a powerful exercise when it is encouraged and repeated. We do some individual targeting too when the person is ready for it.